Hi, I'm Dr. Larry Malerba, and welcome to All Things Homeopathy. The conventional medical establishment deludes itself into thinking that homeopathy is nothing more than placebo medicine. The only way to maintain this belief is by denying the mounting evidence to the contrary. In addition to clinical evidence and research trials in support of homeopathy, there's also a vast trove of historical evidence that cannot be denied. Nevertheless, homeopathy tends to be written off as an outdated and unscientific therapy, but nothing could be further from the truth. In this episode, I've gathered together some amazing historical facts regarding homeopathy's ability to successfully treat epidemic diseases. It's important to understand that successful homeopathic prescribing is not based on the name of a disease or the name of the bug that is causing the disease. It's based on the symptom pattern of the sick person. So while new viruses and bacteria will always be on the horizon, human symptoms will remain the same as they have ever been. And there's a homeopathic remedy for just about every symptom pattern that you can imagine. It's high time that everyone finds out about the world's best kept medical secret. You be the judge.
Okay, so first up I'll talk about typhus, which is an infectious disease characterized by a rash, headache, fever, and oftentimes delirium. Historically, typhus has a high mortality rate during wars and famines. Although not transmittable, people are at risk during an outbreak from disease-carrying fleas, lice, and mites. In 1813, a typhus epidemic hit Leipzig following Napoleon's march through Germany. Allopathic mortality rates at the time were higher than 30%, but amazingly, Dr. Hahnemann himself, the founder of homeopathy, used his new therapy to treat 180 typhus cases, and he lost only 2 patients. That's 1.1%. This chart from Dr. Thomas L. Bradford's book, The Logic of Figures, published in 1900, gives comparative data from a typhus outbreak in Vienna, Austria. It reveals that the typhus death toll from 1850 to 1853 in Vienna's homeopathic hospital was essentially half that of the local allopathic hospital. While the average homeopathic mortality rate was about 10%, the average allopathic rate was 20%. Diphtheria is a bacterial infection that causes a thick membrane to form in the back of the throat. It can cause difficulty breathing, paralysis, and even death. The disease is easily transmittable from person to person. The D in the DPT vaccine stands for diphtheria. Dr. Bird, an allopathic physician from Cedar Rapids, Iowa, filed a report in 1879 that compared allopathically and homeopathically treated cases of diphtheria. The homeopathic death toll was 6%, and the allopathic rate was 17%. Medical records from Broome County, New York, from 1862 to 1864, reveal a dramatic difference in diphtheria cases treated by allopathic and homeopathic physicians. While there was an 83% allopathic mortality rate, the mortality rate among diphtheria cases treated by homeopaths was only 16%. Naturally occurring variola, or smallpox, is considered to have been fully eradicated since about 1980. There is no allopathic cure for smallpox, which produces flu-like symptoms and a rash, and the vaccine is considered too risky for routine use. This chart compares a variety of illnesses, among them smallpox, treated by allopathic and homeopathic means in Vienna, Austria. Note that while the allopathic mortality rate for smallpox was 33.3%, the homeopathic rate was only 18.5%. Dr. Routh of London was an avowed critic of homeopathy, so much so that he was compelled in 1852 to publish his Fallacies of Homeopathy. However, he subsequently compiled comparative data from both allopathic and homeopathic hospitals. Of 32,000 homeopathic patients treated, the overall mortality rate for all diseases was 4.4%. For the same number of allopathic patients, the mortality rate was 10.5%. Dysentery is often spread through contaminated food or water. Symptoms include bloody diarrhea, abdominal cramps, and fever. Modern allopathic treatment includes IV fluids and antibiotics. This chart shows dysentery statistics reported by the very same Dr. Routh. While the death rate was 22% in allopathic hospitals, it was only 3% in homeopathic hospitals. Also known as scarlatina, scarlet fever is known for its bright red rash. It's a disease of children usually accompanied by a sore throat and high fever. Scarlet fever can spread very easily. The homeopathic remedy belladonna is almost as specific for scarlet fever because the symptoms that the remedy can cause in its crude form so closely resemble the symptoms of the disease. In 1799, Dr. Hahnemann experimented with belladonna as a prophylactic treatment during an outbreak of scarlet fever. Having observed Hahnemann's success, 11 other medical doctors prescribed the same remedy during the same epidemic. They gave a total of 1,646 children prophylactic doses of belladonna. Only 123 of the treated children, or 7.4%, developed scarlet fever. Those who did not receive the remedy had an infection rate as high as 90%. This chart documents the results obtained by another group of physicians utilizing the same strategy. Of the 2,027 children receiving belladonna, only 79 developed scarlet fever. That's a 3.9% infection rate. Here's another chart that compares treatment of scarlet fever by the two different schools of medicine. Allopathic treatment resulted in a 20.6% death rate. Homeopathic treatment had a remarkable 2.2% mortality. That's a tenfold difference. And finally, in 1838, after Hahnemann's close colleague, Dr. Christoph Wilhelm Huffland, had published his Prophylactic Power of Belladonna in Scarlet Fever, the Prussian government ordered the use of prophylactic belladonna during all scarlet fever epidemics. Cholera is an infectious disease that causes severe watery diarrhea. It's caused by consuming contaminated food or drinking water and can lead to rapid dehydration. Cholera is usually fatal if not treated right away. Here we see a chart of cholera cases treated by various European allopathic hospitals during the period 1831 to 1832. The average death toll, even when taking into account the anomalous last entry on the chart, which lists 1 death out of 100, the average mortality, including that number, turns out to be 57 out of 100. This chart shows cholera patients treated by homeopaths throughout Europe during the same time period. The average death toll per 100 patients was 11.6. The difference in outcomes between the two medical camps is stunning. Over an extended period of time from 1831 to 1848, cholera cases treated allopathically at home had a 39% mortality rate. Cases treated at home with homeopathy had a 9% death rate. Allopathic cases treated in hospitals had a 57% death rate, while cases treated in homeopathic hospitals had a 33% mortality. Another close colleague of Hahnemann, Dr. Clemens von Benninghausen, treated and prevented large numbers of cholera cases during the European epidemic of 1849. While conventional allopathic treatment produced a death rate of anywhere from 54 to 90%, Benninghausen's patients had a mortality rate of only 5 to 16%. And here's another fascinating bit of history. The story of the 1854 cholera epidemic in London, England, has been recounted many times before. It's of historical significance because it was the first time that cholera had been traced to a specific source, in this case, a public water pump. The pump was closed and the epidemic ended, but not until 10,730 people had died. Here I'm quoting directly from a presentation given by Janie Goddard titled Homeopathy in Epidemics and Pandemics, delivered at the Conference for Scientific Research in Homeopathy in March of 2010. Quote, the British House of Commons requested a report regarding the various methods of treating the epidemic. When the report was issued, no homeopathic figures were included. The House of Lords requested an explanation, and it was admitted that if the homeopathic figures were to be included, it would skew the results, so it was suppressed. Upon examination, the buried report revealed that under allopathic care, the mortality was 59.2%, while under homeopathic care, it was 9%, unquote. The last serious European cholera epidemic took place in Hamburg, Germany in 1892. 8,600 people died. As with all previous outbreaks, the homeopathic recovery rate was superior to the allopathic rate. This time, homeopathic mortality was 15.5%, while the allopathic rate was 42%. Yellow fever is an acute viral hemorrhagic disease transmitted by mosquitoes. Symptoms include fever, headache, jaundice, muscle pain, and vomiting. Serious cases can be fatal, and no specific allopathic treatment for the disease exists. The worst yellow fever epidemic in U.S. history occurred in 1878. There were 5,000 deaths in Memphis alone and 20,000 deaths overall in the Mississippi Valley. A number of years later, Dr. A.L. Monroe of Louisville gave the president's address at the third annual meeting of the Southern Homeopathic Medical Association. He reported statistics that resulted from treatment of yellow fever that involved over 1 million prescriptions given to 500,000 patients. These prescriptions were administered by 1,000 physicians from each of the allopathic and homeopathic schools. In the final tally, the allopathic mortality rate was 15.5%. The homeopathic rate was 6%. This chart shows comparative statistics during the Civil War for several conditions encountered at the time, including dysentery, typhus fever, and pneumonia. Comparable numbers of patients were treated in both allopathic and homeopathic hospitals. As you can see, while death rates in the allopathic hospital ranged from 50 to 70%, mortality in the homeopathic hospital was virtually nil. Here's another chart that compares homeopathic and allopathic treatments in 1895 for measles, scarlet fever, typhoid fever, and diphtheria. Again, we see the results from homeopathic treatment are clearly more favorable. And in this chart, we see comparative statistics from Broome County, New York. The results of allopathic and homeopathic treatments for diphtheria, pneumonia, dysentery, and croup were recorded from 1862 to 1864. The differences in mortality rates are staggering. For diphtheria, the rates were 83% and 16% in favor of the homeopathic camp. For dysentery, it was similarly 78% versus 22%. For croup, the allopathic mortality rate was 78%, while the homeopathic rate was only 21%. And for pneumonia, it was 91% to 8%, again in favor of homeopathy. And speaking of pneumonia, while pneumonia is not typically an epidemic disease, the ultimate cause of death resulting from some epidemic diseases is often attributed to pneumonia. This happened to be the case in the Great Spanish Flu Pandemic of 1918. The outbreak was one of the worst in human history, with estimates of up to 50 million deaths worldwide and with 675,000 deaths in the United States alone. The source of the outbreak is still debated today, and those who have studied homeopathy are acutely aware of how history is written by the victors, which is why when you read modern accounts of the 1918 pandemic, homeopathy is almost never mentioned. Now, homeopathy was much more popular back then than it is now, at least in the United States. There were 100 U.S. homeopathic hospitals and many more outpatient clinics. And although there is a good bit of documentation regarding homeopathic treatment of the Spanish flu, conventional medical historians have made sure that you would never know about that. So let's take a look at some of that forbidden history. But before we do, I'll remind you that homeopathy has an extraordinary historical record of success in treating both the flu and pneumonia. The pandemic of 1918 turned out to be a deadly combination of the two. In 1920, Dr. W. A. Dewey published a paper in the Journal of the American Institute of Homeopathy documenting the experiences of his fellow homeopathic physicians in dealing with the pandemic. For example, 30 homeopathic physicians from Connecticut reported a total of 6,602 cases treated with total deaths numbering 55, which is a mortality rate of less than 1%. Dr. Herbert A. Roberts treated 81 soldiers on a military transport ship. They all survived, but Roberts knew of another ship that lost 31 men, none of whom were treated with homeopathy. Dr. Frank Weiland of Chicago reported treating 8,000 patients with only a single death. The only homeopathic remedy that he used was gelsemium. The Homeopathic Medical Society of the District of Columbia reported 1,500 cases with only 15 deaths. Again, that's 1%. Dr. McCann of Dayton, Ohio, reported treating 1,000 cases without a single loss of life. Numerous homeopathic physicians made the same observation, which was that their allopathic colleagues were relying heavily on aspirin as their primary therapeutic treatment. The results were not good. Dr. W. A. Pearson, Dean of Hahnemann Medical College in Philadelphia, reported a tally of 26,795 cases treated by homeopathic physicians at his venerable institution. The final mortality rate was calculated to be 1.05%. In contrast to the homeopathic statistics, the mortality rate of patients under allopathic care was sometimes as high as 30%.
As you can see, homeopathy's track record in treating epidemic disease is unparalleled. The facts are as clear as day. Homeopathy is a timeless therapy that works just as well today as it did in bygone times. Please help the world learn about the healing power of homeopathic medicine by liking and sharing this video. Thanks for watching, and be sure to tune in again to the next episode of All Things Homeopathy.